Insulin resistance and diabetes are closely related conditions that impact the body's ability to manage blood sugar levels. Insulin resistance occurs when cells in the body don't respond effectively to insulin, leading to higher blood sugar levels, and it often presents subtly with signs such as fatigue or weight gain, particularly around the abdomen. On the other hand, diabetes manifests when the pancreas is unable to produce enough insulin or when insulin resistance has progressed to the point that blood sugar levels remain consistently high, exhibiting more overt symptoms like increased thirst, frequent urination, and blurred vision. Treatments vary from lifestyle changes such as diet and exercise to medications, including insulin therapy in more advanced cases. Risk factors for both conditions include genetics, obesity, sedentary lifestyle, and poor diet. Here's detailed aspects of these closely intertwined diseases, from their origins to how they affect daily life. Onset of condition: metabolic dysfunction versus chronic hyperglycemia. Insulin resistance and type 2 diabetes are intricately related, yet distinct conditions. Insulin resistance precedes type 2 diabetes and is characterized by the body's reduced ability to respond to the hormone insulin, leading to altered metabolism of carbohydrates, fats, and proteins. Initially, the pancreas compensates by producing more insulin, but over time, this can lead to beta cell exhaustion. When pancreatic beta cells can no longer maintain the hyperinsulinemic response, chronic hyperglycemia ensues, marking the onset of type 2 diabetes. The progression from insulin resistance to diabetes involves a complex interaction of genetic, environmental, and lifestyle factors, disrupting glucose homeostasis and increasing blood sugar levels. Early intervention in insulin-resistant individuals can prevent or delay the development of diabetes by helping to maintain the delicate balance of blood glucose through diet, exercise, and medication. Primary factors: lifestyle and obesity versus glucose regulation failure. Insulin resistance marks the body's diminished ability to respond to the hormone insulin, which is crucial for regulating blood sugar. Initially, it manifests as a warning sign, often attributable to factors like sedentary lifestyles, high-calorie diets, and obesity, which heighten the risk. The pancreas compensates by producing more insulin, keeping glucose levels in check, despite the resistance. However, as insulin resistance progresses, this compensation fails, leading to prediabetes and eventually type 2 diabetes, characterized by the pancreas' inability to maintain adequate insulin production for glucose regulation. This shift from a state of overcompensation to outright failure is a critical juncture where intervention through lifestyle changes and medication can drastically alter the disease trajectory. Complication risk: metabolic syndrome versus microvascular and macrovascular damage. Insulin resistance and diabetes, while closely related, present unique risks in terms of complications. Insulin resistance, often a precursor to type 2 diabetes, is a significant component of metabolic syndrome, which includes a cluster of conditions such as high blood pressure, abnormal cholesterol levels, excess body fat around the waist, and high blood sugar. This constellation of factors greatly increases the risk of heart disease, stroke, and type 2 diabetes itself. On the other hand, uncontrolled diabetes can lead to serious microvascular and macrovascular complications. Microvascular damage affects small blood vessels, potentially to retinopathy, nephropathy, and neuropathy, which can result in blindness, kidney failure, and loss of sensation, respectively. Macrovascular complications involve large blood vessels and can precipitate heart attacks, strokes, and peripheral vascular disease. This distinction is crucial for targeted prevention strategies and effective management of both insulin resistance and diabetes to minimize long-term health impacts. Management strategy: diet and exercise versus medication and insulin therapy. Insulin resistance is an impaired response of the body to insulin, resulting in elevated blood sugar levels. It's a precursor to type 2 diabetes, but can often be managed effectively with lifestyle modifications. Adopting a diet low in refined sugars and high in fiber, alongside regular physical activity, can enhance insulin sensitivity and mitigate the risk of progression to diabetes. On the flip side, diabetes management, particularly when lifestyle changes are insufficient, may require pharmaceutical intervention. Medications such as metformin improve insulin sensitivity, whereas advanced cases might necessitate insulin therapy to maintain glycemic control. The approach pivots on patient specific factors, with the ultimate aim to stabilize blood sugar and prevent complications. Potential for reversal, possible improvement versus lifelong management. Insulin resistance is a precursor stage where the body's cells don't respond well to insulin, reducing the ability to absorb glucose from the bloodstream. This condition can often be improved or even reversed with lifestyle changes such as diet, exercise, and weight loss, addressing its root causes. On the other hand, diabetes, particularly type 2, may stem from prolonged insulin resistance and leads to chronic high blood sugar levels. While diabetes management typically requires lifelong monitoring and may include medication, diet, and lifestyle adjustments, its course can sometimes be altered with significant lifestyle changes, particularly in its early stages, potentially leading to remission. However, unlike insulin resistance, type 1 diabetes is an autoimmune disorder that is generally considered irreversible and requires lifelong insulin therapy.